Hi guys, I'm Carly with Partington Plastic Surgery, and I wanted to talk to you guys a little bit today about microneedling. So microneedling is a treatment we do here in the clinic, and another name for it is called collagen induction therapy. It uses a little handheld device with tiny 33 gauge needles in it that penetrate the skin at about 1,000 times per second. So that induces collagen and elastin and also releases growth factors in the skin. This treatment helps with fine lines and wrinkles, pore size, superficial pigment, some skin tightening, and also acne and surgical scars. Downtime is pretty minimal depending on how aggressive the treatment goes, so around 5 to 7 days. During that time, you just want to stay out of the sun and keep your skin really hydrated. You can apply makeup 24 hours after the procedure and kind of get back on with your daily life, so it is easy to cover after the treatment. We recommend these in a series of about 3 to 6, spaced 4 to 6 weeks apart from each other, and it is safe to do in the summertime if you can just avoid direct sun exposure for a few days. Okay, so we are ready to start our lovely model's treatment today. Her skin has already been cleansed and numbed. I just finished removing the numbing, so now I'm gonna go through with a toner, just make sure that the skin is clean and everything's removed. Might feel a little tingle. Okay, and then I start with a little of our vitamin A, C, and E oil from our Environ product line. This is gonna act as a medium to help the needles glide across the skin. This is the pen-like device that I use, and you can change the depth at which the needles penetrate depending on which concerns you're trying to target in the skin and which area of the face you're on. So we're gonna start on a pretty mild setting for her to see how her skin responds. Is that feeling okay?
Mm-hmm.
So I just do strokes in a pattern of cross-hatching, so vertical, horizontal, and diagonal, and you'll see that the skin starts to have a little bit of erythema. And then I'm going to move on to my next section. Okay, so you can see some nice pinkness to the skin, but we don't have any pinpoint bleeding yet, which we want to see that because that's going to release growth factors into the skin and help with extra collagen stimulation. So I'm going to go a little bit deeper. Feeling okay?
Mm-hmm.
And that looks great. Okay, so we've done all of her face except for this little area right here. She has a post-surgical scar, and microneedling works really great on scarring because we can get in there and physically puncture the scar tissue and help to smooth everything out. So I'm gonna treat at a deeper setting. I'm gonna do some passes and then a stamping technique to really break up that tissue and diminish the appearance of the scar. Is that okay?
Mm-hmm.
Okay, so now that we've finished the treatment, I'm just going to apply a couple of products on her skin for post-care, and a sunscreen is necessary just to protect it from the UV rays. So her skin is going to be red for about 48 hours. It will continue to get better throughout the days. Then on about day 3, she'll get a sandpaper texture to her skin where it's dry and flaky, and that's going to be the dead damaged cells sloughing off. That will last anywhere from 3 to 5 days, just depending on what condition her skin is in and how aggressive we went. So she's just going to want to use gentle cleanser, gentle moisturizer, and a sunscreen for the next few days while her skin gets back to normal, and then she can continue using her normal products.